So if I was to provide a broad overview of the CHSA charity, I'd say it was set up to do one task, which is to distribute 5 million quid given to us generously by TikTok, and to distribute that to frontline workers who are suffering or in distress because of COVID. In all the talk about COVID, I didn't hear much talk about frontline. For me, it was like a chance to do something directly focused on the frontline providers of care.
It's been a really unique operation in some ways. It's brought together this group of diverse organisations with one common purpose, and that is to help and support health and care staff who've been affected by the pandemic in many, many different ways.
So the pandemic has really impacted intensive care teams at all levels. Peer-to-peer projects are a really fantastic way of helping healthcare staff. So what we're doing in our project with the Intensive Care Society, with the support of the CHSA, is we're training people up so that they can, on the clinical shop floor, they can spot signs in their peer and they can come up alongside and offer that support. So CHSA funding has helped and had an impact because it's enabled us to deliver training free at the point of contact.
So the recipient organisations that CHSA has funded, I think, have responded magnificently. It's not just about the support that they've provided to their own stakeholders and their own beneficiaries, but also really responding quickly to the mental health needs and making sure that actually support is available to the people that need it the most.
At the beginning of the COVID pandemic in the UK, the biggest problems that care workers and people they work with faced was lack of PPE. So the grant that we have received from CHSA has supported us greatly in the help that we can give to care workers financially. So all of the funding from that went into giving grants to care workers around self-isolation, shielding, additional childcare costs and other issues related. On top of that, earlier this year we started mental health support, where eligible care workers can apply for up to 10 hours of one-to-one therapy. So yes, even one-off payments in terms of financial support can have a very long-term impact on people's lives.
Despite the CHSA being a short-term charity, it has the potential to do some long-term good because we focused on people who are low paid. That will have a long-term impact, there's no question. There wasn't much else doing this sort of work. And hopefully it'll have a long-term impact on some of the organisations that we funded, because there's some real learning about how to do coaching, consulting, mental health interventions for frontline. So yeah, short-term charity, long-term impact.
The difference that the CHSA grant has made to us has been a complete game changer. We wouldn't be able to offer this service without it. The Talk to Us listening service provides an opportunity for nurses to be able to have a listening service with a nurse who's got experience and who is a trained listener. So nurses everywhere are being supported specifically because we've got the CHSA grant.
It's been a sort of unique opportunity really to have a positive impact on the lives of health and care staff right across the UK, across all settings and in all professions. And I think that's been its true legacy, is that it has helped so many people from such a diverse group.